So, thank you for attending and joining Donna and myself for the diabetes overview and glucose monitoring and sharing your valuable time with us. Diabetes is a complex disease. You may have heard conflicting theories on what causes it, how it's diagnosed, and how it's managed. We at ConnectCare 3 are eager to share our evidence-based information from the American Diabetes Association on causes, diagnosis, and management of diabetes. You will find this knowledge empowering. So hello, I'm Jennifer Kalis, registered nurse and nurse coach with the ConnectCare 3 Chronic Disease Management and Prevention team.
Good morning, everyone. I'm Donna Penny. I, too, am a registered nurse and a member of the Chronic Disease Management and Prevention team as well. So, there are several types of diabetes, and we will be looking at type 1, which usually occurs before the age of 30. There's also gestational diabetes, which occurs during pregnancy, and then type 2, and that does usually start later in life, and it accounts for about 90 to 95% of the cases of diabetes. So with that being said, our focus today will be on understanding type 2 diabetes. You're going to see the course content for the next 6 weeks, so feel free, and we definitely would love to have you join us for each week to learn more. All right, so during today's presentation, you're going to get a better understanding of what diabetes is, the importance of knowing your numbers, and how you're at the center of your care.
So as we get started, we are curious. Please let us know if you have diabetes by typing A in the chat feature to all panelists, B in the chat feature to all panelists if you do not have diabetes but know someone with diabetes, or maybe it's both A and B, where you have diabetes and you know someone who has diabetes. Thank you. Let's take a moment. We're going to start to look at these. So it looks like some of you know someone with diabetes, some of you have diabetes, some of you have prediabetes or looking for an opportunity to reverse that. So today you will learn how you can support those that you know as well as take care of yourself. Thanks again for joining us. All right. Go ahead. Excuse me, I'm going to back up the slides a moment. There we go, Donna.
Thanks. All right, so let's take a look at prediabetes and diabetes. What is it? Why does it happen? And what is the end result? So if you take a look at the video, and you're going to see that glucose that your body makes is in response to eating, and it will get absorbed through the intestinal wall and then enter your bloodstream. And as the video demonstrates, your sugar, or glucose, is represented by the yellow circles. And then what happens is the pancreas responds to the increased sugar level by producing insulin, and you'll see the little purple dots. So insulin is the thing that you need to open up the cells to allow the glucose to enter and then provide your body with energy. So what did you notice about the ratio of yellow circles to purple circles in the video that's playing right now? If you said that there are more yellow dots than purple, then you are 100% correct. But the big question is why? Why is there more sugar than there is insulin? Again, remember, yellow is sugar, purple is insulin. So the pancreas isn't able to produce enough insulin, or your cells are resistant to the insulin, meaning that the glucose can't get into the cell. So to sum it up, diabetes is the inability of the body to take the sugar out of the bloodstream and put it where it needs to go, which is into the cells to give your body energy. So basically, it's too much sugar in your bloodstream. So who's at risk for prediabetes and diabetes? Jennifer is going to tell us.
For some, the diagnosis of diabetes comes as a complete surprise. But for others, it's an expected event. They think, oh, it was just a matter of time. And why is this? It's because they knew that they were at high risk for developing the disease. And these are the risk factors that people have when they know that they might get it. There's many of them. There's those that you can control, and those that you can't control. So let's talk about those that you have no control over. Anyone who is 45 years old or more is at an increased risk for type 2 diabetes. And let's face it, there's nothing any of us can do about getting older. There's also nothing you and I can do if we have family members who have diabetes. So if your mother, your father, your sister, or brother has diabetes, there is a greater chance of you developing diabetes. And I'd like to just pause and say, you know, someone may have risk factors. It doesn't guarantee that someone will get diabetes, but it certainly predisposes them and increases the possibility. So some other things people don't have control over. If a woman gets gestational diabetes while they are pregnant, so if you know someone, a family member, a friend, and they've had gestational diabetes, you want to be sure that they know to tell their primary healthcare provider about that so that they can be monitored to prevent the disease. You also don't have control over your ethnicity. There are many ethnic groups that are more likely to develop type 2 diabetes. These groups include African Americans, Mexican Americans, American Indians, Native Hawaiians, Pacific Islanders, and Asian Americans. So those are the risk factors that none of us have control over. However, we do have control over our level of activity, our food choices, high blood pressure, and weight management. So being active and managing weight can significantly delay the onset of type 2 diabetes as well as reverse pre-diabetes. So now that you know what is diabetes and who is at risk to develop it, let's look at the symptoms. Excuse me. There we go, Donna.
All right, thank you. So symptoms of diabetes. All right, so the first one is the fatigue that people experience or always feeling tired. That's because your body isn't getting the energy it needs from the food you're eating. So you feel tired. Remember in the video you saw the little yellow circles or the glucose trying to get into the cell? If there's not enough insulin there, boom. The glucose won't get into the cell, and as a result of that, you feel tired. You could feel thirsty, and that's because water is being pulled from the tissues to help get rid of the extra sugar. And because you're losing lots of water, your brain tells you to drink more water to get rehydrated. So that's why you may feel thirsty a lot. Frequent urination. So your kidneys need to make more urine to help pass the extra sugar from your body, and you will likely have to urinate more and have a higher volume of urine as a result. Next up is always feeling kind of on the hungry side. So even though you're eating, the lack of insulin or the resistance to the insulin basically causes the starvation of your cells, and that's when you need to have that glucose in the cell and you don't, so the body will keep telling you that you're hungry, that you need that sugar, and that in turn causes diabetics to feel hungry. And then next is sudden weight loss. So when your glucose doesn't move into the cells, the body thinks it's starving, like I said, and finds a way to compensate. So what does it do? It creates energy by burning fat and muscle at a very quick pace, and that's what leads to the unexplained weight loss that people with diabetes have. Blurred vision can also be a symptom of diabetes, and the high blood glucose levels cause the lens of the eye to swell, and that changes your ability to see. And then the last one is wounds that won't heal. And so there are a number of factors that can affect your body's ability to heal wounds. And when your blood glucose level is high, it doesn't allow your wound to heal as well. So what happens is it prevents nutrients and oxygen from getting into the cells. It prevents your immune system from functioning efficiently, and it also increases inflammation in the body's cells. So people with diabetes are twice as likely to develop poor circulation or peripheral vascular disease, which also causes your blood vessels to narrow and reduce blood flow to your limbs. So you put all of these effects together and you end up with slower wound healing. So now what we're going to take a look at is how the amount of glucose in your blood is measured. Jennifer?
Thanks, Donna. So your healthcare provider diagnosed diabetes by knowing how much glucose, or sugar, synonymous terms, is in the blood. The tests used to diagnose diabetes are the fasting plasma glucose and hemoglobin A1C. Your healthcare provider also monitors diabetes and help avoid complications by monitoring these test results. In other words, these tests, fasting blood glucose and A1C, tell you and your healthcare provider what is happening in your body, even if you don't feel it or see it. Looking at the arrow on the left, a fasting plasma glucose test measures the blood glucose after not eating overnight or at least fasting for 8 hours. Let's call it a snapshot of your blood glucose. A normal level is 100 milligrams per deciliter, and prediabetes is diagnosed when that fasting plasma glucose is 100 to 125 milligrams per deciliter. So this means that the blood glucose level is higher than normal, but not high enough to be considered type 2 diabetes. So it's an opportunity with some lifestyle changes to delay the development of type 2 diabetes. And lastly, diabetes is diagnosed with a fasting blood glucose of 126 milligrams per deciliter or more, typically along with additional blood tests. Now, looking at the arrow on the right, the hemoglobin A1C test reflects the average blood glucose over the previous 2 to 3 months. You might call it a 3-month report card. It is measured as a percentage. Because the A1C test does not require fasting, blood can be conveniently drawn at any time of day. It's a primary test used for diabetes management, as well as research. A lower percentage indicates what we call good glucose control. However, the higher the A1C level, it's what we call poor glucose control. So an A1C reading of less than 5.7 is considered normal. Prediabetes is diagnosed when the A1C level is 5.7 to 6.4%, and a diabetes diagnosis occurs with an A1C of 6.5% or higher, typically on 2 separate tests. And just to note, an A1C level below 7% is the typical goal for people with diabetes, because it reduces the risk for complications like heart disease or stroke or kidney disease. So complications are not inevitable. So we'll talk more about these blood glucose levels and A1C levels next week. We'll give you some more details. So if you don't know your target glucose or A1C level, we suggest contacting your healthcare provider or looking in your patient portals at your hospital to obtain this information so that you can understand more next week. And plus, knowing these numbers puts you in control of your diabetes and able to enjoy life. So a key takeaway, you can understand how it's essential to obtain the lab test ordered by a healthcare provider and to check blood glucose levels daily if that's what's been ordered. Next, Donna is going to explain what happens when there's too much glucose in the bloodstream for too long. It means complications can occur.
That it does. All right. So as I talk about these complications, I would love for you guys to utilize the chat feature and just let us know if you're experiencing any of the ones you see listed on the slide. So it's important to know that with each episode of high blood glucose, it can cause minor damage and then over time can lead to major complications. So poorly controlled diabetes or an A1C greater than 8% can affect pretty much all the systems of your body. And poorly controlled diabetes can cause retinopathy, which causes vision loss and blindness. It also can cause nephropathy or kidney disease and kidney failure. And it affects the blood vessels and can cause poor circulation, especially to your feet and to your legs. And this is called neuropathy. Oftentimes, I shouldn't say often, but because of neuropathy, people with diabetes are at a greater risk for amputation.
So Donna, if I may interject, I'm wondering if folks who know someone with diabetes, if they have seen their friends or family members have some of these complications, and certainly you're welcome to chat those to us as well if you know someone who has complications.
Yep. And I'm sure they see the impact it has on their lifestyle as a result of those complications.
Absolutely.
All right. Two others, or one other, that I do want to mention is the risk of cardiovascular disease, which includes that higher incidence of stroke and heart attack, and also heart failure. So we'll talk about these complications in detail in week number 3, so join us for that. But we're going to take a look at the complications that have popped up here in the chat feature. And we had one person who mentioned that somebody they knew had diabetic neuropathy and that they had that tingling and that burning in their feet. Fortunately, they didn't mention any issues with amputation, so hopefully they're doing well. All right, so we're going to take a look now at some treatment that is recommended by healthcare providers that is going to help prevent these complications. Jennifer, you want to tell us all about that, please?
I'd love to. So again, if you have heard of any of these treatments, either for someone you know or for yourself, please feel free to note those in the chat feature addressed to all panelists, as you know people who are managing their diabetes. So, living with diabetes, we all know, is not easy. The choices that people make have an impact on blood glucose levels every day. And what happens every day affects the future health of that person. Consequently, controlling blood glucose levels and living well with diabetes means a health plan that includes a healthcare team and self-care that happens at home. In other words, diabetes and self-care go hand in hand. Now, your healthcare provider is the expert on diabetes, and you are the expert on your life. By working together to combine what they know about diabetes and what you know about yourself, it is possible to come up with a workable plan. And when diabetes is well managed, people feel hopeful and energetic. Life is good and satisfying. So let's look at these. Living with diabetes means regular visits with a primary care provider or a diabetes specialist called an endocrinologist. These providers could be a family doctor, a nurse practitioner, or a physician assistant. It also means regular blood glucose monitoring, because these are the numbers that show you and your healthcare provider how the treatment plan is working, maybe what's going well and what could be improved. So it's important to check blood glucose levels at home as well as A1C levels as ordered by a healthcare provider. How often someone tests and when will be based on the blood glucose control and the treatment plan. Now, living with diabetes also means thinking about what to eat and how you move every day. It means following a healthy diet. We do know that being overweight makes insulin less able to do its job, getting the sugar into the cell, and therefore it increases the blood glucose levels. So even losing a small amount of weight makes insulin more efficient. It happens in the cells. With that said, I invite you to consider reaching out to Connect Care 3 to partner with one of our registered dietitians to learn how to make healthy food choices and develop a personalized eating plan. This could be for folks with diabetes or pre-diabetes. And we talked about moving, exercise. Exercise, particularly resistance training, improves the body's use of insulin and can lower glucose levels. Being active also helps lower blood pressure and protect you from heart disease. A reasonable goal is 30 minutes of moderate activity on most days of the week. And at Connect Care 3, our health coaches, whom you'll meet later in the webinar series, as well as our dietitians, they're trained to work with you to design an exercise plan that fits your interests and your lifestyle. And just a reminder, we ask that you get approval from a healthcare provider before beginning any exercise program, and a health coach would talk with you how to do this. We also believe that part of a diabetes treatment plan is that you learn everything you can about diabetes. It's about knowing the facts, the treatments, how they work, as well as how to use this information in your everyday life to feel your best. You'll learn more about these lifestyle treatments in detail in weeks 4, 5, and 6, and we hope you'll join us. Donna?
Thanks. So, living with diabetes can mean medical treatments being prescribed by your healthcare provider. So, if diet and exercise do not get your glucose levels under control, Your healthcare provider may prescribe either an oral diabetes medication or insulin, or it could be a combination of both. Some people with diabetes don't make enough insulin, and some people just, what they do produce isn't being utilized properly. So different people will need different types of medications to control their blood sugars. The goal of taking care of diabetes is to feel well today, and then to avoid unwanted complications in the future. And just as a side note, we will be talking about medications and insulin next week. So if you are interested in knowing more about that, tune in.
Don, I see here that someone was interested in education, and their provider recommended they see a diabetes educator.
Excellent.
Similar to what we're doing here, but with real personalized care.
Yes, yes.
Excellent.
Absolutely. Take advantage of those programs. They will arm you with what you need to be able to make really good decisions about how you move forward. Yeah. Alrighty. So have you guys ever heard of the mind-body connection? It's well known that the health of the mind affects the health of the body. Jennifer's going to talk to us about that.
Well, we all know that with diabetes, you have a lot on your mind. Sometimes you may feel discouraged, worried, frustrated, or just plain tired of dealing with the daily demands of caring for your health. Maybe you've been trying hard but not seeing positive results, or you've developed a complication like retinopathy in spite of your best efforts. Feelings can be overwhelming and may lead to what we call diabetes distress, anxiety, and/or depression. And these can make it challenging to keep up with your daily routines, like checking your blood glucose level, checking your feet, and eating healthy snacks. If this has happened to you, I want you to know you are not alone. You may be relieved to know that in any 18-month period, it's been shown that 33 to 50% of people with diabetes experience diabetes distress. 20% are more likely to have anxiety at some point in their life, and people with diabetes are 2 to 3 times more likely to experience depression. Now, these may be startling statistics, but they are not hopeless statistics. Help is available through your healthcare provider and/or counseling. With diabetes, feeling physically good is half the battle. Feeling mentally good is the other half. Both are important because when mental health issues get better, diabetes tends to improve as well. Now, you have learned a lot about diabetes today. What it is, who is at risk for it, what are the symptoms of diabetes, how it's diagnosed, and what treatments are necessary to prevent unwanted complications. So now I invite you to join Donna for a fun activity to begin to wrap things up.
All right. So I have some true and false questions for you guys, and just go ahead and put your answers in the chat box, and like we've been telling you all day now, address them to all panelists. And here we go. So true or false? Diabetes is the inability of the body to move glucose out of the bloodstream and into the cells. Is that true or false?
We'll wait for a few moments for some answers. Is that true or false?
You guys can be fast typers. It's just a couple letters.
You can also just type a TRF if that's easier for you.
That is a perfect idea. All right, looks like the consensus is true, and that is absolutely true. I talked about that earlier today. Moving glucose out of the bloodstream into the cells is the issue, and so those of you that said true are right on target. All right, the next question or statement. The desired A1C level to reduce the risk of complications is 8%. Is that true or false? And again, just type in a T or an F. Keep it simple. Excellent. We've seen lots of F's coming through. In the past, an F on a report card is horrible, but today that's a good thing. An A1C below 7% is the goal for people with diabetes because it puts you at less risk for heart disease, stroke, kidney disease, eye problems, foot problems, nerve damage. If it's greater than 8%, then that puts you at a greater risk for these complications. So good job with that one. All right, next, the liver is responsible for producing insulin, the key to opening and allowing glucose to enter cells. Is that true or false? All right, we've got a 50-50 split here. So for those of you that said that it is false, you're right on target there. It is the pancreas that produces insulin, not the liver. Your liver produces the glucose. Okay? Next question or statement. Healthy eating and physical activity can help to lower blood glucose levels. Is that true or false? Oh, liking this one. You guys are good. I'm seeing lots of trues or T's. So yes, healthy eating does make a difference because blood glucose levels can be controlled by making good, healthy choices. Physical activity, same thing. It helps bring that blood sugar down. All right. So good job. You guys have done a really good job. Jennifer, where do we go from here? What are we looking at next?
Well, as we begin to conclude today's webinar, Donna, we invite everyone to consider what decisions they want to make regarding living with diabetes and feeling their best. So next steps that may benefit you as an attendee or someone that you know are listed on the slide. Choose the action steps which are most important and relevant. They matter to you. And you'll have the opportunity to tell us about those next week if you're interested. So what are they? You could obtain your last A1C results and bring it along next week, or your target blood glucose range and bring it along to next week's webinar. You have diabetes, maybe you want to speak with your adult children about their risk for diabetes so their physicians and healthcare providers can monitor them. And maybe you want to enroll in the Connect Care Free Chronic Disease Management and Prevention Program to partner with our registered nurses, certified health coaches, or registered dietitians. And maybe there's another next step that you've identified that's important and relevant to you. So Donna, how does someone enroll in the Connect Care Free program?
Oh my gosh, Jennifer, that's so easy. So look, you got a number up there, it's a toll-free number, just give that number a call, or you can email us at info@connectcare3.com or tap into our website. Basically, once you utilize one of those methods of communication, you're going to have an encounter with our patient advocates who will guide you through the process, and it's very simple. It doesn't take much time at all.